Is there something sitting inside your medicine cabinet right now that could be slowly damaging your heart without you ever feeling it? Something you swallow every day with complete trust because a doctor prescribed it or because it's sold openly at the pharmacy. Not experimental drugs, not rare treatments. But the painkiller you take for your knees, the capsule you swallow for your stomach every morning, or the flu medicine you grabbed last week without a second thought. These are medications so common, so accepted, and so widely prescribed that no one ever imagines they could be harming the most important organ in the body, quietly, silently, beat by beat. For more than 2 decades working in operating rooms and emergency care, I witnessed something that changed the way I see medicine forever. I saw people with no previous history of heart disease arrive with severely damaged hearts. People who exercised, who ate reasonably well, who followed medical advice faithfully. When we investigated deeply, the cause wasn't genetics. It wasn't lifestyle. It wasn't bad luck. Again and again, the common thread was medication. Medicines taken every day with trust. Medicines meant to help, not harm. Medicines people believed were protecting them while silently creating a ticking time bomb inside their chest. What I am about to explain goes against what most people have been taught. It is not exaggeration and not conspiracy. It is based on medical evidence, clinical experience, and real patients. There are 5 categories of extremely common medications that can weaken your heart over time, especially after the age of 60. Understanding them could mean the difference between years of healthy life and a sudden, unexpected cardiac event no one saw coming. Before going further, this information matters. If you value your health and the health of people you love, this message needs to reach them. Many are at risk without knowing it. Let's begin with something almost everyone has used: painkillers, specifically non-steroidal anti-inflammatory drugs. Names you know well: ibuprofen, naproxen, diclofenac, Advil, Motrin, Aleve, Voltaren. They are everywhere. In purses, kitchen drawers, glove compartments. They work fast and effectively, which is exactly why people take them so casually. But after the age of 60, regular use of these medications can be extremely dangerous for the heart. The medical community has known this for years. In 2005, the FDA required warning labels on these drugs due to increased risks of heart attack and stroke. In 2015, those warnings became even stronger, stating that cardiovascular risk can appear within weeks of use and increases with higher doses and longer use. Yet millions of people still take them daily, unaware of what's happening inside their bodies. I remember a patient named Marcus, a 72-year-old man who loved gardening. Arthritis in his knees made it painful, so he took ibuprofen almost every day, 4 pills, sometimes more. One afternoon, while tending to his roses, he suddenly became breathless, exhausted, and noticed severe swelling in his legs. He arrived at the emergency room in acute heart failure. His lungs were filling with fluid. His kidneys were shutting down, yet he had no history of serious heart disease. The cause was clear: chronic high-dose NSAID use. These drugs cause the body to retain salt and water, dramatically increasing blood volume. The heart must pump harder against this overload. In older hearts already stiffened by age and hypertension, this can push the system